Let's get right into it. Now, Joe Rogan is shocked by what the CEO of a big pharmaceutical company says in terms of technology that they're either trying to make or have made. And what this technology does is very, very alarming, I would say. And within this clip that I'm about to play, they're going to reference a video. When they reference that video, I'm going to interrupt and I'm actually going to play the video for you. That way you can actually see it and not just hear it. So you can make your own determination because they go in a little back and forth, Jamie and Joe, whether this is a real clip, whether he said this, whether it's out of context. And I just want you to have the full context right away. But before I bring you that clip, I got to take you to the store. You've heard of the Great Reset. Please join the Great Resist instead. It is much better and the clothing is much cooler. You don't want to be dressed like Klaus Schwab in that weird, Darth Maul suit that he usually wears when he's on stage, right? You don't want to be a part of that. We also got the Sold Not For Sale t-shirt and the whole line, I have to say. Just so you guys know, we have the shirts, hoodies, t-shirts, women's sizes, kids sizes, tank tops, mugs, all that good stuff. Let's get into the video. Oh, and if you're someone who's purchased from there, thank you so much. You have no idea how much it helps. You have no idea how much we appreciate it. Thank you, thank you, thank you. Let's get into the video. Switch it up. There we go.
They make all kinds of good stuff. They make diabetes medication.
I love dick pills.
Pandemic creates new billionaires every 30 hours. Now 1 million people could fall into extreme poverty at the same rate in 2022.
Yeah.
Whoa.
573 people became a billionaire, it says.
Whoa. I thought they were just talking about the United States. Is that the world? In the world?
I don't know.
That can't be in the United States. We have 573 billionaires?
Probably the world, I guess.
Yeah, they might come after us if that's true.
Yeah.
It's nerve-wracking, man, because the people that have that kind of money and that kind of power, they want to maintain that position and they want to maintain that influence over people. And the best way to maintain it is to tighten down on what people are allowed to do.
Yeah.
Where they have to comply. I mean, the CEO of Pfizer, there was a famous speech where he's giving where he's talking about a pill that you would have to take that sends off a signal to show that you've taken it. And he says, imagine the compliance. This is what he says.
Yeah.
Have you seen him say that?
No.
Let's find that. Find where he says that. Because it's so bonkers. Like compliance. Like,
God.
You know what I mean?
It's scary.
Comply.
Yeah.
You're making people go. So that word, that term, just the thought process behind that statement is so crazy.
Encourage would be better. Comply, like you have no choice.
Here it says,
pills.
Edited to cut important context. CEO Albert Bourla explains. So what is the actual? But it's okay. It says the video discussing ingestible pills with sensors has gone viral, falsely presented as an interview from 2022 and edited to cut out important context. One Twitter user shared the clip on May 20 here, commenting, Pfizer CEO Albert Bourla explains Pfizer's new tech to Davos crowd, ingestible pills, a pill with a tiny chip to send a wireless signal to relevant authorities when the pharmaceutical has been digested. Imagine the compliance, he says. Now, is that really what he said?
Let's see.
So what does he really say?
Yeah, there's
what's
video.
Cut out if he says that? See, this is one of those things where you got to wonder if they're trying to gaslight you with the headline. He commented on biological sensors during a conversation on general technological advances in healthcare and pharmaceuticals. So what has he said? In response to a question from the audience, ideas to engage patient, he calls the research and field fascinating. He says that there's already a pill approved by the U.S. Food and Drug Administration. He moves on to describe this pill, and where the clip version seen on social media begins, and he later concludes, but of course there will be an initial cost and someone needs to invest. Bourla was not talking about a Pfizer drug or technology. Rather, he was describing Abilify MySite, a drug with a digital ingestion tracking system, right?
So that is it.
Okay, for the treatment of schizophrenia, acute treatment of manic and mixed episodes associated with bipolar 1 disorder, and for use as an add-on treatment for depression in adults. So he was talking about a different pill, but he was talking about a pill with a sensor.
But the point is,
still the same thing.
That is true. So they can say, well, it's for this schizophrenia or manic. So that's why that's how they got it approved, but now it's out there.
Right. Well, now it's an actual technology, and if they can mandate a medication that you have to take
so they
for
make
something else.
They make it sound good by, that maybe that would help those people, but now it can be used on everybody.
Yeah. So here it says that. So it basically is a biological chip that is in the tablet. And once you take the tablet and it dissolves into your stomach, it sends a signal that you took the tablet. So imagine the applications of that. Compliance.
Okay.
So did he say, imagine the applications of that, compliance, and then they edit it to say, imagine the compliance?
I think that's what it's saying.
Let's see him say it.
Here's
I was going to say we just play the video.
Yeah, let's play the video.
And then...
All right, so I got the video for you guys. You guys tell me if this is something that looks edited to you. Let's flip over here. There's this gentleman, this potential lizard person. Let's get into it.
It is basically biological chip that it is in the tablet. And once you take the tablet and dissolves into your stomach, sends a signal that you took the tablet. So imagine the applications of that, compliance. The insurance companies to know that the medicines that patients should take, they do take them. It is fascinating what happens in this field. Chip that it is in the tablet, and once you take the tablet and dissolves into your stomach, sends a signal that you took the tablet. So imagine the applications of that, compliance.
I don't know about you guys, but that just sounds like he's saying the applications of this are compliance. That, you know what I mean? He's like, imagine the applications, comma, compliance. Because everybody would have to take it, because everybody, you would know who didn't take it and who did. But yeah, I just wanted to show you guys that, just so you had your own, because you're not going to be able to see the video the way I have it set up. And, you know, you couldn't see it anyway because the screen's so small. So, yeah, I just wanted to make sure you guys saw that. And you tell me what you think. You think that was edited? That didn't seem edited. Didn't seem like there's no cuts there. There was no room for out of context. Like, that is something that's being developed or is developed already. Either way, even if it's just on their minds, it's still worrying. It's still alarming, like I said in the beginning. So just wanted to put that out there. Great point by Cameron Haynes, by the way. It's always safe. It's always safety. It's always convenience. It's just easier. And then the next thing you know, and it's only for these people here. And the next thing you know, it's for everybody. So let's get back into the clip.
Let's play the video.
So it would be this one.
It is basically biological chip that it is in the tablet. And once you take the tablet and dissolves into your stomach, sends a signal that you took the tablet. So imagine the applications of that, compliance. The insurance companies to know that the medicines that patients should take, they do take them. It is fascinating what happens in this field.
That doesn't comfort me, if that's what he really said.
No, but he's saying, so if you have a schizophrenic patient,
right, and they have to take it,
they to know that they did or didn't take their medicine like they're supposed to.
Yes,
but yeah, you could use that on anything. Then
you could use it on anything.
Once they get it, down the whatever approved, then it's there.
Exactly.
Yeah.
Exactly. And once it's been applied before, they can apply it to other things. And if they can mandate that everybody takes a medication, they have that.
For health and safety.
And especially if you have an application. Now, if you have an application, this World Health Organization digital passport, it sends a signal to your passport. And if you don't, you're not going anywhere.
And they just say it's for health and safety.
It's all bonkers.
Yeah.
And the fucking headline that they had to that is like...
Yeah.
That's that thing that they do.
Know.
The
they
gaslighting
twist shit around.
thing.
Yeah.
Yeah. We were reading this thing about Al Pacino.
Yep, there you go. And yeah, again, Cameron Haynes has it right. It's for this small group of people, and it's for their best interest, and it's for the safety of them, so they can't harm themselves or others. But then the next thing you know, and this is a real thing. This is a real thing I'm about to bring up. There is healthcare. There's people right now in Canada who are they're trying to create studies that young men who go from 16 to, I believe, 21 years old, who are interested in maintaining a strong, healthy physique, may have a mental disorder, and healthcare professionals may have to get involved. That's a real thing. I did a video on it a few months back. So I only bring that up to say, what's the next thing they say is a condition of sorts that needs to be taken care of, and all of a sudden they're mandating certain, I don't know. Yeah. It's rough. But it's a great episode. Again, Cameron Hanes, Joe Rogan. That part ended at 2 hours, 33 minutes, 21 seconds. Great episode. I'm telling you, near the last hour of this, and the link in the description for the full interview, near the last hour, they get into a lot of great topics. They really push the envelope. And it's all Cameron too. It's all Cameron. It's not Joe getting into it. It's Cameron asking these questions and pushing Joe to give answers. Like, it's actually really, really great. Really commendable to Cameron Hanes. Cameron Hanes also has a podcast called the Keep Hammering Collective. He has interviews with Tulsi Gabbard. He has interviews with people like the co-founder of, or the founder of Under Armour, who's also a very conservative gentleman, very head-on straight, squared-away guy. A lot of military people that he interviews, a lot of athletes that he interviews. Just it's a solid podcast. He's getting really, really good at it. But let me know what you guys think in the comments. Maybe I'm overreacting. Maybe we do need these pills that send a message to a database so everybody knows that you took your pill, and then Facebook sends you a little thing that you can put over your picture that says, I took my pill. I took my medicine. Just kidding, of course. But let me know in the comments what you guys think of. Oh, and like the video, please. If you listened this far, please like the video. It helps so much. You have no idea. It helps us so much. And if you share, oh my gosh, send me your name. I'll my firstborn. I'll all the names that end up sharing. I'll give my firstborn all of those names for sure. Kidding, of course. Don't let my wife watches this. Kidding, honey. Kidding. Other than that, I am out.